Now, today's topic is actually a question: when can you start Medicare? And this is a question posed by somebody that is getting ready to turn 65. When will they begin Medicare? Welcome to Medicare School Daily, where we help you understand Medicare, save money, avoid making mistakes, and above all else, get the most out of your Medicare benefits. Well, there's two different scenarios here. First off, if you are already receiving Social Security benefits, meaning you've signed up for Social Security and you're receiving those retirement benefits, then your Medicare A and B card is going to be mailed to you automatically about 100 days or so prior to your birth month. So a little over 3 months, that Medicare card is going to show up in your mail, and your A and B dates are going to start on your birth month. So that's when we begin Medicare during our 65th birth month. Now, there is one exception to this, and that is if your birthday falls on the first day of the month. So let's say your birthday was July 1. Your coverage actually will begin 1 month prior during the month of June. Yeah, let's say your birthday's in December, it's going to start in November. So they always move you back to the previous month if you're born on the first day. But if your birthday is on the second day thereafter, your coverage will always begin on your birth month. Now, secondly here, if you're not receiving Social Security, in other words, you've made a decision you're not going to take your Social Security early, you don't want that reduction in benefit, but you are going to start Medicare at 65, then you are going to need to self-enroll. And when you self-enrolled will determine when Medicare is going to start your coverage. So again, this second group of people not taking Social Security, but you are going to start Medicare. And this would be anyone who is not covered by an employer plan, or their spouse is not covered by an employer plan, and you're not on Social Security. So you may have a retiree plan, or maybe a COBRA plan, or maybe an ACA plan. You're going to start Medicare at 65, but you'll need to self-enroll. And so there's a specific timeline for self-enrolling into Medicare. And again, we call this enrollment opportunity the Initial Enrollment Period. Initial Enrollment Period, and it only lasts 7 months. And so the month that you choose to enroll will determine when they start your coverage. So it's very important to choose the right month based upon when you want your coverage to begin. So let me give you a quick example. This is someone that's born during the month of July. Now keep in mind their birthday is July 2nd to the 31st, because remember, if they're born July 1, we would start their Medicare coverage 1 month earlier, so this whole timeline would change. But if we're born on the second day thereafter through the 31st, this is our 7-month window. And so notice, if I enroll my 3 months before my birth month, the result will be my coverage will begin July 1. So any enrollment during these 3 months will start my coverage July 1. But watch what happens. If my birthday is in July and I enroll into Medicare in July, my coverage will be delayed 1 month. And so what happens here, you're going to see they begin to delay our coverage when we enroll. So enroll in July, delayed to August. If your birthday is in July and you enroll in August in that system, they'll delay your coverage until October. So they put it off a couple months. If your birthday is in July and you enroll in September, now your coverage is delayed October, November, and you don't start until December 1. If you enroll in October with the July birthday, they delay you November, December, and start you January 1st. So as you can see, the month that you enroll determines when they start your coverage based upon this timeline that I just explained. All right, so that's for those of you that have to self-enroll. You want to do it at the right particular time. Now, there's 3 different scenarios that I'm going to teach you about real quickly in this video, and that is this. So when can you start Medicare? Well, if you're not working at 65, you need to start Medicare now. So if you or your spouse are no longer working, you're going to need to begin Medicare at 65. If you're on Social Security, the card shows up, you're going to keep the card. If you're not, you're going to have to self-enroll, and you're going to do so at 65 based upon those 7 months that I just explained. So if you're not working, you've got to begin Medicare at 65. The only people that don't start Medicare at 65 are those that are working or their spouse is working and they're covered by an employer-provided plan of 20 or more people. All right. Now, secondly here, you must self-enroll if not on Social Security. And there's a process that you'll have to follow. You would go to ssa.gov and set up a My Social Security account. You then can enroll into Medicare. Remember, people that are on Social Security are automatically enrolled, but those of you that are not are going to have to take action. You'll have to do the self-enrollment. Now, thirdly, then you're also going to have to decide at this time the other insurance. Very few people today have Medicare A and B only. Most people don't like the risk of that or the financial liability. early so they would get other insurance products. Those are called supplemental plans, prescription drug plans, or advantage plans. And you can begin to enroll in those and make all those decisions as you're getting your Medicare set up as well, so that your A and B begins on the effective date and the other insurance that you have also begins at the same time. So you've got to make those other insurance decisions during the same time frame. All right, now the second group of you are those people that are working or your spouse is working and you're covered by that employer-provided plan, but that group has 19 insureds or less, and you fall underneath a different set of rules, and that's this. Medicare says if you're in a small group, 19 or less, what will happen is Medicare A and B pays first, and your group plan is going to pay second to Medicare. And so if you don't enroll in Medicare and you have some kind of a large claim, then that group plan is going to say, no, we're a small group plan. You should have enrolled into Medicare because we're only going to pay second to Medicare. So you have to initiate that enrollment to be sure Medicare is in the first payer position. All right. And so we encourage you to be sure that you take initiative to enroll into Medicare A and B if you're in a group of 19 or less. Put Medicare in the proper payer position. Now, I will tell you this. Most people that have to do this to go on A and B because of small group also drop the group plan, because what happens is that group plans are going to pay second to Medicare, and normally their premiums are a little higher and maybe the deductibles higher, and normally that a group plan is not as good a secondary payer as what it has been as a first payer. And so again, most people drop the entire group plan totally, and they go on Medicare A and B, and then at that time, then they decide on other secondary insurance. So you enroll in A and B, you decide whether you want an advantage plan or a supplemental plan or a prescription drug plan, and all those then are going to go along with your Medicare coverage. So most people in small groups actually will come out of the group plan totally. All right, then that brings us to our last group, and that's those of you that are working or your spouse are still working at 65 and you're covered by a large group plan. That means there's 20 or more insureds in the group. And again, there's some very different rules for you in these large group plans. Number one, you don't have to do anything. You don't have to take A, you don't have to take B. Now, the problem is most of you have heard that you have to enroll in Medicare A at least, or you're going to be penalized. And folks, that's simply not true. If Medicare A is free for you, because you or your spouse have 40 quarters paid into the Medicare tax system, A will be free for the rest of your life. So you will not be penalized if A is free. All right, so you don't have to do anything. Now, some of you may choose to go ahead and enroll into A only, and that is not a bad decision unless you are contributing to a health savings account. That's called an HSA. Those are not flexible spending accounts. They're not health reimbursement arrangements, but only HSAs. Because if you enroll in A only and you're contributing to an HSA, you have to stop your contributions to your HSA. And so I think there's wonderful benefits to HSA. So that's why I'm saying I wouldn't do anything and just say, pick up A and B at a later date. But if you do take A, it is fine as long as you're not contributing to an HSA. All right. And then thirdly, some of you may decide that you're going to enroll into A and B and just get off the group plan and get other types of insurance. And again, we have people regularly that call us and ask us to help them to evaluate whether they should go on Medicare while they're still working. And many aren't today. And the reason is that as they lay those two options beside the group plan at work, 20 or more people, or Medicare A and B with other insurance, many times Medicare makes more sense. Now, sometimes it doesn't. As we evaluate the premiums and the coverage and your medications and we lay those side by side, sometimes the group plan will make sense and people stay on that. But other times it will make sense to go on Medicare, and then you'll get other insurance products as well. Again, drug plans, supplemental plans, or advantage plans. All right, and so this is the process that you who are in large group plans need to follow to make sure that you're going on Medicare at the right time. Hey, thanks so much for watching the video, and I do hope that it was helpful. Now, if you feel like you need to learn more about Medicare to make sure you're making the right Medicare decision, really the best way and the easiest way to do that is to go to MedicareSchool.com. That's MedicareSchool.com, and you'll be given the opportunity to click on Get the Free Workshop. We call that the Essentials Workshop, and I do all the teaching, and there you'll learn all the ins and outs of Medicare to make sure that you have an accurate and thorough understanding of how Medicare works. The second thing you can do is click where it says Talk to a Medicare Guide, and there you can actually set up a time where you can discuss your situation with the Medicare Guide. They'll explain all your options, and they'll actually even walk you through the enrollment process as well if that's what you need to do. And so go to MedicareSchool.com, watch the workshop, or talk to a Medicare Guide. It would be our privilege to assist you further.